So we're going to move on to Chapter 25. And Chapter 25 covers the entire surgery section of the CPT book. So it covers from, I think it's page 87, 83, all the way up to page 508. Okay, so if you'll notice within that section that you're going to have, that section is going to be broken down by body system. Okay, so you're going to have intake, musculoskeletal, respiratory, digestive, etc. Okay, so let's talk about surgical procedures. And one thing I'll tell you, we're kind of just handling the basics in this course. We're going to really dig deep into these codes in 205 and 219. Okay, so just be prepared for that. All right, so so let's talk about what a procedure is. Okay, so surgery is essentially a procedure. It can be incision and drainage, a debridement, a repair of a wound. Okay, it can be diagnostic. Okay, something about those things are like a scope, like endoscopy, bronchoscopy, things that diagnose the problem. And then it can be therapeutic to fix a problem. One thing that you need to know about CPT codes is if it starts as a diagnostic procedure, let's say they start doing a scope, they find something, like let's say it's a colonoscopy, and they start with a scope and they're looking to find they're looking for something, and then they immediately turn it to a therapeutic and they find a problem and they fix it while they're there, it becomes a therapeutic procedure. You can't code both the diagnostic and the therapeutic. That's going to be in your guidelines, which I'm going to show you. Okay. So here are some definitions about approaches. Okay. Some of your descriptions in your CPT book are going to be about approaches. So make sure you pay attention to these definitions. Okay? All right, and then let's move over to the surgical package. So we talked about it before in the anesthesia, about the anesthesia package. So if you will look on page 84, you're going to see some guidelines for the entire surgery section that apply to that list of page from 83 to page 508. Okay, so the surgical package always has the E&M code where there's a decision for surgery. Okay, so you don't get to bill that separately. Any kind of local, digital block, topical anesthesia. Remember, topicals on the skin. The procedure itself with any services normally considered part of that procedure. Okay, the immediate post-op care, which means when the patient goes to the recovery, and any follow-up, so removing of sutures, staples, cast, etc., because that's a normal part of follow-up. Okay, things that it doesn't include: any kinds of procedures, lab tests, x-rays, etc. It doesn't include post-op therapies or a more complicated version of the original procedure. Okay. Also, you might have some things that are what do we call staged, where they know they're going to take them back to the OR for a second visit. Okay, and that's planned up front. And then any kind of post-op complications. So if there's complications, infection, anything like that, they have to take them back to the OR. That's not covered under the original code, so there's additional billing there. Okay, so let's now talk about global times. So every procedure has what's called a global period or a post-op period. And this might be hard for you to determine how many days it is, and so we'll work on that, okay? But some things have 0 days. There is no post-op period, Okay. Some have 10. Something that's minor would have a 10-day period. A lot of the major surgeries are going to have 90 days, which is actually 92 because one day before the surgery, the day of the surgery, and then 90 days after that. Okay. All right. So here are some of those modifiers again about unusual treatments, like more than one physician. Let's say that patient had a surgery and somebody else did it, and they had to move, and so they went back to a different physician for just the post-op only. So what the insurance company will do is they'll take that code. Remember I told you every CPT code has a dollar value assigned to it depending on the insurance company, and that CPT code they'll take out the portion for the pre-op and the surgery, and then the portion for the post-op, and they'll pay each doctor, they'll split their money for that code. Okay? That's why it's important to always use the codes and the modifiers to tell the whole story. Okay? If a physician has to do more than what is normally required, then you can add a 22. However, you have to make sure the documentation is there. Okay? If you put a 22 on something, you're going to have to send in the op report to the insurance company. Okay. All right, so let's go over here. So from this point on, you're going to have a section on each of the body systems. Okay. So I want to go through an example with you. Okay, so let's do that. So let's go up here. Let's look at this example. Okay, so we have Bobby, a 36-year-old male, cut his left thumb at work on a construction site 2 weeks ago. He didn't get any treatment. Now it's infected, and so now the doctors admitted Bobby to the hospital, and they're going to amputate his thumb. Okay, and so here, this should ring a bell right here. The procedure is made more complicated by the spread of the infection. Okay, ding, ding, ding. That should tell you there's a modifier. Okay. So the doctor is trying to save as much of the hand as possible, but we've got infection and the procedure is more complicated. So the word that we're going to look up, because the procedure that we're doing is amputation. So pause here, flip to the back of CPT, and look up the word amputation. So when you get to amputation, you're going to see that there's there's body parts, right? You're going to see ankle, and then arm, lower, revision, arm, upper, with some things under that, okay? So we're amputating the thumb. So let's go to thumb. And you see we've got three choices. We've got a 26910, a 26951, and a 26952. Now look up there where it says leg, upper, leg lower, and it says 27598, 27880-27882. That means all the codes between 27880 and 27882 are possibilities for that, which that just means there's three in this case, okay? But in our case, they're listed separately. There's three options, but they're listed separately with a comma, okay? So what I recommend that you do is you keep something on this page, which is page 977, okay? Because you may have to flip back there. So let's start at 26910. I'm going to put my keys on this page, and I'm going to flip over to 26910. So stop here and flip there, and it's on page 181. Okay? So 26910, the code description is amputation metacarpal with finger or thumb, single with or without interosseous transfer. Okay? So then the next one is amputation. So then our next option, which happens to be 26951, is that next code, and the 52 is the next code. So they're all right there together. So amputation, finger, thumb, primary, secondary, including neurectomies with direct closure, And then the 5.2 is amputation, finger or thumb, primary or secondary, any joint or phalanx, single, including neurectomies, with local advancement flaps. Okay, so our documentation doesn't say anything about removing a nerve, because that's what a neurectomy is. Okay, so we are amputating the thumb. So of those three, okay, we are amputating the thumb. Okay, it doesn't say anything about the interosseous transfer, but since it says with or without, that's going to be our option. Okay, so our code's going to be the 26910. Now, we need to add the Hicks-Picks modifier for the digit. So if you flip back over to that document, you're going to find the left thumb, the modifier for the left thumb. And then also, remember I said up here we had ding, ding, ding modifier where it says it's made more complicated by the spread of infection. So we're going to have another modifier, okay, for a complicated procedure. Okay, so here's our 22 for the additional increased procedural service. Okay, and then the FA is our left thumb, is the modifier for the left thumb. Okay? So then each section, going back to your book, each section you're going to have a section on integ, you're going to have a section on musculoskeletal, okay, respiratory, etc. So this chapter is taking up a whole lot of your CPT book, but it's just kind of skimming over the top. Okay? And like I said, we'll go into much more depth of these codes in 205 and 219, so that's why I say don't throw away your book.